Many people in our community require the use of prosthetic and orthotic treatment. A prosthetist provides treatment for patients with limb loss. This treatment includes the provision of an artificial limb, known as a prosthesis. An orthotist provides treatment for patients with physical impairments. This treatment includes the provision of an orthopedic brace, known as an orthosis. Both professions require patient assessments, fittings, and follow-up care as part of the treatment process.
I think an aspect of prosthetics orthotics that most people don't understand is that we're quite unique in the fact that we get to see a patient or a client from the very beginning of their treatment process, and you get to be influential and part of the rehab team right through to the end. The really neat thing is that you make lifelong relationships with these people, so those patients become your patients for life, and so you see them ongoing. Even once the rest of the rehab team is gone, you're still involved with their care long term. And in fact, most amputees in particular consider their prosthetist their primary health care provider, the ones that they find a really important part of their care. And orthotically speaking, I think we have a very unique approach to patient care, and that again we see the whole picture from start to finish. We have the ability to modify that treatment program, to make adjustments, to intervene and to make changes, and to go to the table with different types of options for them that are a really important part of taking them to the next level.
About 3.5 months ago I had a skiing accident. They've prescribed me with this knee brace. The foot thing is basically, it allows me to walk as I would normally without an injury.
An undergraduate degree is a prerequisite to the 2-year diploma program, followed by a 2-year residency. A certification exam must be completed at the end of the residency to ensure qualification.
I like that right away we get our patient experience, and I also like that once a week we get to do rotations around the city so that we can, for instance, we shadow orthopedic surgeons, physiatrists, physiotherapists, and we get to see patients from a different perspective. So we get to see them from the physiotherapist perspective and from the surgeon perspective, which is interesting when you compare it to how we see it with our own prosthetist and orthotist.
Prosthetic and orthotic practitioners work closely with other healthcare professionals such as physiotherapists and orthopedic surgeons to promote the highest standard of patient care. The field also relies heavily on the support of technicians, who are also specially trained for the prosthetic and orthotic field.
As a technical instructor, I try to teach the complexity of the manufacturing side of our profession. I try to expose them to the vast array of materials and procedures involved, so that they can take that as a working knowledge and be comfortable applying that to their patients.
Every part of it I love. There's the personal satisfaction of actually getting to make something and fabricate something. There's the satisfaction of getting to help somebody in their lives. There's the fact that it's kind of artistic and yet at the same time very engineer-like. Just literally everything about it makes me excited to come to work every single day.
My leg lets me keep up with the other people in my class, especially in PE, and be really good in goalie. And pretty much, yeah, it helps me do most of the things that acquire moving.
The prostheses, it allows me to do anything I want to do. That, to say, I cycle, I jog sometimes, I go in for long walks. It allows me to do my work. I'm on my feet most of the day. It allows me to live.
I would say that it's a creative science and an art that goes together, and you're basically using your knowledge of materials, and you're using your knowledge of biomechanics, you're using your knowledge of physics, but also interpersonal psychology and quality of life kinds of things. You're trying to create a device for somebody that they can actually use to improve their quality of life.
In our P&O profession, the people that get into it they genuinely care about other people, and I think that's a big plus right there. And one of the biggest misconceptions, I think people think that we just make people arms or legs or give them a brace. We just deliver a product. And to me, it's just really disheartening to hear something like that, because you develop such great relationships with your patients. And I think the colleges and the universities are really preparing the students very, very well right now. And there's so much interest in research in our field. And I think it's really good that you have the chance to do a lot of research projects and things yourselves. And with that, I think the future of prosthetics and orthotics is going to be amazing. To me, it's not just doing my job, it's just getting into it. I love it. After all these years, it's just one of the best things, and I'm so happy that I picked this field over other fields.
It's exciting to be a part of this field at a time where there's so much change and so much new technologies coming out, and so it'd be exciting to see where this field is going to head in the future, and it's cool to be a part of.
With the laughing for 10 minutes.
Once. I'll learn this to be.
Yeah, this looks good. We're good.
Okay.
If you want one of these, I'll sell it to you.
What's that? As a technical.
So,
See that on camera.
The Canadian Association for Prosthetics and Orthotics is the national professional organization for the field of prosthetics and orthotics in Canada. It represents more than 500 certified and registered practitioners across Canada and internationally. Its purpose is to promote professionalism, ongoing education, and awareness to both its members and to the public, and to encourage outstanding clinical and technical skills in the field of prosthetics and orthotics.